NCSBN-NCLEX RN 800 questions with answers newest exam simulation. Question 1. What is evisceration? Option A. Excoriation. Option B. Dehiscence. Option C. Decortication. Option D. Protrusion of viscera. The correct answer is option D. Protrusion of viscera. Evisceration is protrusion of abdominal contents. Question 2. What is the most immediate nursing intervention for a client with ruptured membranes? Option A. Note color and amount of fluid. Option B. Assess fetal heart rate. Option C. Notify physician. Option D. Perform nitrazine test. The correct answer is option B. Assess fetal heart rate. Umbilical cord prolapse is a risk after rupture requiring immediate fetal heart rate assessment to check for distress. Question 3. What hormone causes uterine contractions during breastfeeding? Option A. Estrogen. Option B. Prolactin. Option C. Oxytocin. Option D. Progesterone. The correct answer is option C. Oxytocin. Oxytocin is released during suckling and promotes both the milk letdown reflex and uterine involution. Question 4. How should the nurse respond to a mother grieving a stillborn? Option A. Tell her it is God will. Option B. Tell her she is young. Option C. Tell her other children will comfort her. Option D. Offer to let her see and hold the baby. The correct answer is option D. Offer to let her see and hold the baby. Holding and seeing the baby helps parents validate the reality of their loss and facilitates the grieving process. Question 5. When is the best time to immunize a pregnant client who is non-immune to rubella? Option A. Immediate postpartum period. Option B. After first trimester. Option C. At 28 weeks gestation. Option D. Within 72 hours postpartum. The correct answer is option A. Immediate postpartum period. The rubella vaccine is given immediately postpartum to protect the mother in future pregnancies while avoiding teratogenicity. Question 6. Which food choice helps relieve both constipation and anemia in pregnancy? Option A. Prunes. Option B. Green leafy vegetables. Option C. Red meat. Option D. Eggs. The correct answer is option A. Prunes. Prunes provide significant dietary fiber and iron, making them an ideal choice for this prenatal client. Question 7. What factor in a client history places her at risk for gestational diabetes? Option A. Maternal age under 25. Option B. Pregnancy weight under 20% of ideal. Option C. Previous birth of infant weighing over 9 pounds. Option D. Family history of heart disease. The correct answer is option C. Previous birth of infant weighing over 9 pounds. A history of delivering a macrosomic infant weighing over 9 pounds is a strong clinical predictor for gestational diabetes. Question 8. What is the nursing intervention for early decelerations on a fetal monitor? Option A. Notify physician. Option B. Turn client to left side. Option C. Continue close monitoring. Option D. Administer oxygen. The correct answer is option C. Continue close monitoring. Early decelerations are reassuring patterns associated with head compression and require no intervention beyond continued monitoring. Question 9. What does an L/S ratio of 1:1 indicate in amniotic fluid? Option A. Lung immaturity. Option B. Intrauterine growth retardation. Option C. Intrauterine infection. Option D. Neural tube defect. The correct answer is option A. Lung immaturity. A ratio of 1:1 indicates that surfactant levels are insufficient for fetal lung maturity. Question 10. What is the purpose of RhoGAM administration at 28 weeks gestation? Option A. Treat existing antibodies. Option B. Prevent Rh sensitization. Option C. Induce labor. Option D. Prevent neonatal infection. The correct answer is option B. Prevent Rh sensitization. RhoGAM prevents the development of maternal antibodies in Rh-negative women exposed to Rh-positive fetal cells. Question 11. Which activity should a pregnant woman with varicosities avoid? Option A, sitting with legs crossed at ankles. Option B, wearing thromboembolic disease stockings. Option C, wearing support pantyhose. Option D, wearing knee-high stockings. The correct answer is option D, wearing knee-high stockings. Knee-high stockings create a constricting band that restricts venous return and exacerbates varicosities. Question 12. What indicates true labor? Option A, contractions weaken with walking. Option B, contractions strengthen with walking. Option C, cervix does not dilate. Option D, fetus does not descend. The correct answer is option B, contractions strengthen with walking. True labor contractions intensify with activity and result in progressive cervical change. Question 13. What is the cause of anemia in a first trimester prima gravida? Option A, increased blood volume. Option B, decreased blood volume. Option C, fetal blood volume increase. Option D, increased iron absorption. The correct answer is option A, increased blood volume. Maternal blood volume increases significantly during the first trimester, causing a physiological dilutional anemia. Question 14. When is a fetus most susceptible to drug-induced malformations? Option A, first trimester. Option B, second trimester. Option C, a third trimester. Option D, every trimester. The correct answer is option A, first trimester. Organogenesis occurs during the first trimester, making this the period of highest risk for fetal damage. Question 15. What is the priority position for a client with a prolapsed cord? Option A, reverse Trendelenburg. Option B, Fowler position. Option C, a Trendelenburg position. Option D, Sims position. The correct answer is option C, Trendelenburg position. The Trendelenburg position relieves pressure on the umbilical cord by using gravity to shift the fetus upward. Question 16. What is the expected date of delivery for a last menstrual period of August 3? Option A, November 7. Option B, November 10. Option C, May 7. Option D, May 10. The correct answer is option D, May 10. Calculate by subtracting 3 months from August to May and adding 7 days to 3. Question 17. Which nursing action is essential during a precipitous delivery? Option A, control the delivery of the head. Option B, leave to call physician. Option C, push against perineum. Option D, cross client legs. The correct answer is option A, control the delivery of the head. Controlled expulsion of the fetus prevents rapid decompression and potential injury to the infant. Question 18. What are the primary potential complications of vaginal delivery? Option A, dystocia and chlorosis. Option B, Chadwick sign. Option C, fatigue and hemorrhoids. Option D, a hemorrhage and infection. The correct answer is option D, hemorrhage and infection. Hemorrhage and infection are the most frequent and serious complications requiring vigilant postpartum monitoring. Question 19. Which antibiotic is considered safest during pregnancy? Option A, sulfonamides. Option B, tetracycline. Option C, hydralazine. Option D, ampicillin. The correct answer is option D, ampicillin. Ampicillin is a penicillin derivative with no known teratogenicity and is widely considered safe for pregnant clients. Question 20. What symptoms in a newborn warrant investigation for central nervous system dysfunction? Option A, seizures and decreased arousal. Option B, tremors and apnea. Option C, increased arousal. Option D, hyperreflexia. The correct answer is option A, seizures and decreased arousal. Seizures and decreased arousal are clinical indicators of neurological impairment requiring immediate diagnostic evaluation. Question 21. What oxygen concentration is generally safe for premature infants to avoid retinopathy? Option A, less than 40%. Option B, a greater than 40%. Option C, moist oxygen at high flow. Option D, 100% oxygen. The correct answer is option A, less than 40%. Retrolental fibroplasia is linked to prolonged exposure to high oxygen concentrations, so levels are kept below 40%. Question 22. What is the first nursing action for an anxious, hysterically crying client? Option A, demand she relax. Option B, ask what the problem is. Option C, stand or sit next to her. Option D, give her a task. The correct answer is option C, stand or sit next to her. Presence and proximity offer comfort and security to a client suffering from acute anxiety. Question 23. What effect is expected in a schizophrenic client? Option A, anger. Option B, apathy and flatness. Option C, smiling. Option D, hostility. The correct answer is option B, apathy and flatness. Apathy and a flat affect are classic signs of the emotional blunting seen in schizophrenia. Question 24. A teenage client binges and purges. What is the diagnosis? Option A, anorexia nervosa. Option B, anorexia hysteria. Option C, bulimia. Option D, conversion reaction. The correct answer is option C, bulimia. Bulimia is identified by recurrent episodes of binge eating followed by self-induced vomiting or purging. Question 25. I am God is an example of what? Option A, delusion. Option B, illusion. Option C, hallucination. Option D, conversion. The correct answer is option A, delusion. A delusion is a fixed false belief that is inconsistent with reality and cultural norms. Question 26. A client develops blindness with no organic cause. What is this? Option A, delusion. Option B, illusion. Option C, hallucination. Option D, conversion. The correct answer is option D, conversion. Conversion reaction is the physical expression of internal emotional conflict through sensory or motor dysfunction. Question 27. A hospitalized client becomes dependent and demanding. What is this defense mechanism? Option A, denial. Option B, displacement. Option C, regression. Option D, projection. The correct answer is option C, regression. Regression is the return to an earlier developmental stage as a response to stress or illness. Question 28. A young boy states he wants to marry his mother. What is this? Option A, Electra complex. Option B, Oedipus complex. Option C, superego. Option D, ego. The correct answer is option B, Oedipus complex. The Oedipus complex is characterized by erotic attachment to the opposite sex parent and rivalry with the same sex parent. Question 29. What indicates that benztropine therapy is effective? Option A, smooth coordinated movement. Option B, presence of tremors. Option C, presence of rigidity. Option D, muscle weakness. The correct answer is option A, smooth coordinated movement. Benztropine treats extrapyramidal symptoms and restores smooth motor coordination. Question 30. What is a priority goal for a client with organic brain disorder? Option A, safe environment. Option B, long family visits. Option C, detailed explanations. Option D, challenging programs. The correct answer is option A, safe environment. Maintaining a safe and structured environment is critical for clients with cognitive impairment and safety deficits. Question 31. What is the primary goal of a preschool program for children with Down syndrome? Option A, provide respite care. Option B, facilitate optimal development. Option C, challenging education. Option D, mainstream education. The correct answer is option B, facilitate optimal development. Facilitation of optimal growth and development is the primary goal for all children, including those with Down syndrome. Question 32. What is the nursing priority for a child with hemophilia and knee pain? Option A, elevate and splint knee. Option B, apply heat. Option C, administer aspirin. Option D, range of motion exercises. The correct answer is option A. Elevate and splint knee. Immobilization and splinting stop the bleeding and allow the knee to rest and heal. Question 33. How should a 3-month-old infant with cleft lip repair be fed? Option A. Gavage. Option B. Bottle. Option C. Cup. Option D. Syringe. The correct answer is option D. Syringe. Syringe feeding allows for careful control of volume and placement to prevent pressure on the suture line. Question 34. What is the first symptom of increased intracranial pressure in a child? Option A. Bulging fontanelles. Option B. Seizure. Option C. Headache. Option D. Ataxia. The correct answer is option C. Headache. Headache is a key early indicator of rising intracranial pressure in children. Question 35. What is the appropriate positioning for a child with increased intracranial pressure? Option A. Head elevated 30 degrees. Option B. Flat position. Option C. Head turned to side. Option D. A frequent stimulation. The correct answer is option A. Head elevated 30 degrees. Head elevation aids venous return and decreases intracranial pressure. Question 36. What is the proper positioning 2 hours post-ventriculoperitoneal shunt? Option A. Head elevated. Option B. Elevated head on operative side. Option C. Flat on operative side. Option D. A flat on non-operative side. The correct answer is option D. Flat on non-operative side. Flat on the non-operative side prevents pressure on the shunt valve and sudden fluid drainage. Question 37. What is the primary goal for a newborn of a diabetic mother? Option A. Bonding. Option B. Maintain blood sugar. Option C. Maintain nutrition. Option D. Monitor intake output. The correct answer is option B. Maintain blood sugar. Hypoglycemia is the most immediate life-threatening risk for the newborn of a diabetic mother. Question 38. What hematocrit value in a tetralogy of fallout infant requires physician notification? Option A. 39%. Option B. 10,000. Option C. 60%. Option D. 4 minutes. The correct answer is option C. 60%. 60% indicates polycythemia, which requires clinical attention to manage cardiac and circulation complications. Question 39. Why is volume control tubing used for infants? Option A. Prevents drug administration. Option B. Prevents air entry. Option C. Prevents administration of large fluid amounts. Option D. Prevents phlebitis. The correct answer is option C. Prevents administration of large fluid amounts. Volume control sets prevent the accidental overload of fluids by limiting the volume in the chamber. Question 40. Which insulin can be administered intravenously? Option A. NPH. Option B. Humulin N. Option C. Regular. Option D. Long-acting. The correct answer is option C. Regular. Regular insulin is the only insulin form safe for intravenous use. Question 41. Administer 5 mg of furosemide if the bottle is 10 mg per milliliter. How many milliliters? Option A. 0.5 milliliters. Option B. 5 milliliters. Option C. 0.05 milliliters. Option D. 1 milliliter. The correct answer is option A. 0.5 milliliters. 0.5 milliliters provides the correct 5 mg dosage. Question 42. Administer 2 milliequivalents of potassium if the bottle is 20 milliequivalents per 15 milliliters. How many milliliters? Option A. 1.5 milliliters. Option B. 10 milliliters. Option C. 5 milliliters. Option D. 1 milliliter. The correct answer is option A. 1.5 milliliters. 1.5 milliliters contains the required 2 milliequivalents of potassium. Question 43. 1000 milliliters in 8 hours at 10 drops per milliliter. How many drops per minute? Option A. 21. Option B. 20. Option C. 40. Option D, 60. The correct answer is option A, 21. The calculation, 1000 multiplied by 10 divided by 8 multiplied by 60 equals 20.8 or 21. Question 44. 1000 milliliters in 8 hours at 60 drops per milliliter. How many drops per minute? Option A, 125. Option B, 60. Option C, 30. Option D, 15. The correct answer is option A, 125. The calculation, 1000 multiplied by 60, divided by 480 minutes equals 125 drops. Question 45. 50 milliliters per hour with microdrip tubing. How many drops per minute? Option A, 50. Option B, 20. Option C, 60. Option D, 100. The correct answer is option A, 50. With microdrip tubing, 60 drops per milliliter, the drops per minute equals the milliliters per hour.